will start our second part for the first aid, which we need to provide during any emergency or during any accident or incident at our work site and different other situations. And so far we have covered with the different incident and accidents and how to deal with them. And last we discussed about the artificial respiration. Today we will discuss about cardiopulmonary resuscitation, which we call CPR. So we will start with the CPR and we will progress for the different topics. So for the CPR, as we the full form of CPR is cardiopulmonary resuscitation. So can you save a life in emergency? So when every second is critical, do you know what to do? So according to recent statistics, sudden cardiac arrest is rapidly becoming the leading cause of death in world. Once the heart ceases to function, a healthy human brain may survive without oxygen for up to 4 minutes without suffering any permanent damage. Unfortunately, a typical ERT emergency response team response may take 6, 8 or even 10 minutes. So they will not respond within 4 minutes. So these 4 minutes, what's your work? What is your job? So these 4 minutes you have to get. How? How you will get these 4 minutes? By providing CPR to the patient. So cardiopulmonary resuscitation, which is a CPR, is a life-saving procedure that is performed when someone's breathing or heartbeat has stopped, as in case of electric shock, drowning, or heart attack. So in this situation, people heart that will stop to work. So in that time, we have to provide the CPR, which will be very crucial to get the time for the patient. So CPR is a combination of rescue breathing, which provides oxygen to a person's lungs, chest compressions, which keep the person's blood circulating. So CPR, it is a combination of ECC plus AR. ECC is an external chest compression and the AR is an artificial respiration, rescue breathing, ventilation. So permanent brain damage or death can occur within minutes if a person's blood flow stops. So therefore, you must continue these procedures until the person's heartbeat and breathing return or trained medical help arrives. You have to perform the continuously CPR until you receive any help, emergency help from the medical team or person's heartbeat start to work. So cardiopulmonary resuscitation CPR, it is during those critical minutes that CPR can provide oxygenated blood to the victim's brain and the heart, dramatically increasing his chance of survival. And if properly instructed, almost anyone can learn and perform CPR. But you need to perform it in a very well mannered, and you have to be very careful whenever you are performing any CPR. So CPR timeline 0 to 4 minutes, brain damage unlikely. So brain damage will not happen within 0 to 4 minutes if you will provide the CPR. 4 to 6 minutes, brain damage possibly it can happen if the person will not start to breathe within 4 to 6 minutes. After then 6 to 10 minutes, brain damage probably will happen, and over 10 minutes, probably brain will stop to work. So how CPR works, we will learn through this diagram also, this image. The air breathed in travels to our lungs where oxygen is picked up by our blood and then pumped by the heart to our tissues and organs. When a person experiences cardiac arrest, whether due to heart failure in adults and the elderly or an injury such as near drowning, electrocutions, or severe trauma in a child, the heart goes from a normal beat to an arrhythmic pattern called ventricular fibrillation and eventually ceases to beat altogether. So what will happen? You can see here, this is the rest of the body, and this one, the heart. The blood will go down and up. It will go to head and it will go to the rest of the body. So it will go to the lungs also, and lungs will get the blood flow that will come out also, and this is a oxygen, and it will go oxygen to different parts. This prevents oxygen from circulating. It will stop to circulate the oxygen to different body parts. If person heart will suddenly stop if the person will get any injury or any electric shock or any trauma. So that will suddenly stop the oxygen throughout the body, rapidly killing cells and tissue. In essence, cardio, which is heart, pulmonary association, lung, revive, revitalize, serves as an artificial heartbeat and an artificial respirator. So when you will provide CPR, that time it will give pressure to the heart to work. And that time people will get sudden pressure from outside, external, and they will get the external oxygen also. That person will get the external oxygen by the person who is providing the CPR. Now, how CPR works? CPR may not save the victim even when performed properly, but it will not give you guarantee that you can save the person 100%. But if it started within 4 minutes of cardiac arrest and defibrillation is provided within 10 minutes, a person has a 40% chances of survival. So CPR is a simple but effective procedure that allows almost anyone to sustain life in the first critical minutes of cardiac arrest. CPR provides oxygenated blood to the brain and the heart long enough to keep vital organs alive until emergency equipment arrives or an emergency medical team arrives. To make learning CPR easier, a system was devised that makes remembering it as simple as ABC. A means airway, B breathing, C circulation. Calling for help. So first of all, what you have to do, you have to call for help before you start any CPR. It is critical to remember that dialing may be the most important step you can take to save a life by call any emergency. If someone besides you is present, they should dial any emergency number immediately. If you are alone with the victim, try to call for help first. Try to start any CPR on an adult after a minute on a child. Provide operator with your location. Whenever you are calling to any ambulance for the help, just give them your location, your phone number, type of emergency, and victim conditions. So when you will give these information are very crucial. As per these information, medical team, they will get the medical support with them to make sure that an injured person that will get the proper medical attention. Now, adult CPR, how you can perform the adult CPR. American Heart Association's guidelines detect that adult CPR is performed on any person over the age of 8. The procedure outlined in the following lessons is similar to children CPR and infant CPR, although some critical differences apply. So before you start any rescue efforts, you must remember to check the victim for responsiveness. You have to check that whether the victim is responsive or not. If you suspect that the victim has sustained spinal or neck injury, do not move or shake him. You have to check that whether he is getting any injury or not. Otherwise, shake the victim gently and shout, "Are you okay?" Yeah. First, what you have to do, you can check the victim and you can shout whether he is okay or not to see if there is any response. If the victim is someone you know, call out his name as you shake him. If there is no response, immediately dial and check the airway. First, you have to check the airway, whether he is breathing or not. How you will check the airway? A is for airway. If the victim is unconscious and is unresponsive, you need to make sure that his airway is clear of any obstructions. So what you have to do when you are checking the airway, you have to tilt his head little bit backward and you can check the airway near his nose by your ear. You have to look, you have to listen for clear, and you have to feel for breathing. The breaths may be faint and shallow. Look, listen, and feel for any signs of breathing. If you determine that the victim is not breathing, then something may be blocking his air passage. The tongue is the most common airway obstruction in an unconscious person. Within the victim lying flat on his back, place your hand on his forehead, okay, and your other hand under the tip of the chin. You will put a chin, one hand here and one hand here, and we have to push it back. Gently tilt the victim's head backward. In this position, the weight of the tongue will force it to shift away from the back of the throat and open the airway. If the person is still not breathing on his own after the airway has been cleared, you will have to assist him breathing. How you can assist him breathing? You have to B is for breathing. With the victim's airway clear of any obstruction, gently support his chin so as to keep it lifted up and the head tilted back. Pinch his nose with your fingertips to prevent air from escaping once you begin to ventilate, and place your mouth over the victim's, creating a tight seal. So as you assess the person's in breathing, keep an eye on his chest. Try not to overinflate the victim's lungs, as this may force air into the stomach, so causing him to vomit. So if this happens, turn the person's head to the side and sweep any obstructions out of the mouth before proceeding. Okay. Now give two full breaths. You have to give two full breaths. Between each breath, allow the victim's lungs to relax. Place your ear near his mouth or her mouth and listen for air to escape, and watch the chest fall as the victim exhales. So if the victim remains unresponsive, no breathing, coughing or moving, check his circulation. You have to check the circulation. Now how you will check the circulation? Circulation is in order to determine if the victim's heart is beating. Place two fingertips on his carotid artery here, okay, located in the depreciation between the windpipe and the neck muscles. You have to check it here and apply slight pressure for several seconds. So if there is no pulse, then the victim's heart is not breathing and you will have to perform the chest compression. Now, when you are performing the chest compression, proper hand placement is very, very important. To locate the correct hand position, place two fingers at the sternum, the spot where the lower ribs meet. Then put the heel of your other hand next to your fingers. So when you are giving any chest compression, you have to make sure that you are giving chest compression properly. This is the breastbone. You have to avoid breaking it. Okay, you have to give it here. So it will be properly. When you are giving the chest compression, just keep your hands one upon another one. Okay, you have to place your hands like this and you have to give the compression. So place one hand on top of the other hand and interlace the fingers. Rock your elbows and using your body's weight, compress the victim chest. The depth of the compression should be approximately 1.5 inch to 2 inches. Remember, two hands, 2 inches. So if you feel or hear slight cracking sound, you may be pressing too hard. Do not become alarmed and do not stop your rescue effort. Damaged cartilage or cracked ribs are far less serious than a lost life. If it is damaged cartilage or damaged ribs, let it be, but do not stop your CPR, because saving the lives is more important than break ribs or cracked ribs. So simply apply less pressure as you continue compression. So you have to press little bit less. So count aloud as you compress 15 times and give the victims 2 breaths. This process should be performed 4 times in the span of 1 minute, 15 compression and 2 breaths. So whenever you are giving, so in this one, somewhere you will see that 15 compression and 2 breaths. Somewhere the people, they will follow 30 compressions and 2 breaths. 30 times you have to press and after that you have to give 2 breaths. But somewhere people, they follow the 15 times you have to press and you have to give 2 breaths. But I will suggest you do the 30 compression and 2 breaths. So if there is no pulse, continue performing 30 compressions and 2 breaths, checking the pulse after every 4 cycles. In the span of 1 minute until help arrives. So if you feel a pulse, but the victim is still not breathing, rescue breaths should be administered. One rescue breath every 5 seconds. Remember to pinch the nose to prevent air from escaping. So after the first rescue breath, count 5 seconds, and if the victim does not take a breath on his own, give another rescue breath. You have to continue the CPR until any emergency response team arrives, until any help arrives. So you have to keep doing the CPR. So two main rescue, just like the procedures in one man rescue, ABC shall be applied before proceeding to CPR. If there are two men, how you can perform the CPR? The only difference is is the manner of ratio of ECC, ECC and AR to be given. For one man rescue, 15:2, 4 cycles in 1 minute. For two men rescue, 5:1, 12 cycles in 1 minute that you can follow. Now, when to stop CPR? When you have to stop the CPR? When you have to stop AR? Okay, artificial resuscitation. When the victim is already conscious, breathing with pulse, you can stop. When the rescue is totally exhausted to perform a rescue, you can stop. When another rescue takes his place after completing 4 cycles, when the services of the medical professional takes over, you can stop. And when the medical professionals pronounce that the victim is dead, so you can stop the CPR. So these are the conditions only, then you can stop the CPR. Adult CPR review. In case of an emergency, you may be the victims of only chance of survival until the emergency ambulance arrives and professional assistance is available. You can increase that chances 40% by simply remembering and effectively administering cardiopulmonary resuscitation. So check the response by shouting and shaking the victim. But before you are checking any response, I will suggest you to check for the danger around the person. If there is any danger, you have to remove the danger first. Then you have to start the CPR, and this process you have to follow to make sure that you are not getting injured also. By shouting and shaking the victim, do not shake or move the victim if you suspect he may have sustained spinal injury. Then you have to call for the help. Remember your ABC: airway, breathing, and circulation. You have to check the airway. How you will check the airway? You have to this chin little bit backward, and you have to place your hand here, and you will put your nose, your ear near the nose of the person, and you will feel, okay, and listen the airway, whether the person is breathing or not. After then breathing, pinch the victim's nose and give 2 breaths, watching for the chest to rise the each breath. You have to check that whether the person is breathing or not. If it's not breathing, you have to start the CPR, circulation. How you have to perform the CPR? As you know that you have to place your hands properly on the chest of the person. Do not overpressure. After then, perform 30 compression and 2 breaths. Each cycle you need to continually perform until the person start breathing again, and any emergency ambulance team or any emergency medical team, they arrives at the site. Checks for pulse, and if necessary, perform the cycle again that you need to continue. So that was for the CPR. Now we will look into the choking. Choking is usually caused by a piece of foreign matter such as food becoming lodged in a person's windpipe. Because a choking victim is fully aware that he cannot breathe, normally a sense of panic may overcome them, making assessing the situation and rescue efforts difficult. So when the people they will get choking, they can't talk properly. They cannot shout. Okay. So it is important to try and keep the victim calm in order to determine whether your assistance is truly necessary or if the victim's own coughing reflex is sufficient. So start by asking the person if he is choking or not. So you have to ask. The simple step can be deceptively effective. The victim may be coughing violently or even gasping for air, but if he is able to answer, then he is probably not choking. If he is able to answer, he is not choking. But if he is not able to answer, he is doing like this, gasping, then he has choking. And a choking victim will not be able to speak since oxygen cannot reach his lungs. But if after asking the person if he is choking, all he can do is gesture or point to his throat, and you notice his face starting to turn blue, then he is most likely choking, and you will need to perform the heimlichmaneuver immediately. So now start by finding the proper stance behind the victims with one of your feet planted firmly between the victim's feet. So what you have to do, you have to stand back of the person, and you have to put one of your feet here, okay, and one of the feet here. And after that, place one fist just above the person's navel with your thumb against the abdomen. So above the navel, you have to put your thumb, with tight your thumb. Then against the above the navel and against the abdomen. Place your other hand directly on top of the first. After that, what you have to do? You have to place your other hand directly on top of that. After that, squeeze the victim's abdomen in quick upward thrust. Then you have to squeeze the victim's abdomen up in quick upward thrust as many times as it is necessary to dislodge the object in his windpipe. If he was choked very badly, the chance that he will collapse is imminent. Since he is running out of air, you must probably position yourself and hold him to prevent him directly from falling. Okay. Lie him down properly. Check for foreign object in his mouth by sweeping using one finger. Give full breath to check if his airway is still blocked. If air passed through his airway is clear, then check for ABC, airway, breathing, and compression. If still blocked, kneel beside the victim and apply pressure on the abdomen. Put your two palms just above his navel and make a quick upward thrust. This will push out of the air inside the stomach to explain the foreign object in his mouth. Now you need to at least 8 to 10 stroke and then check for the foreign object in his mouth by sweeping using one finger. Repeat the above procedure until object is expelled and air passes through. So this is the process you have to continuously follow, and you can give 5 palm thrust on his back. If anything is stuck or obstructed the airway, that can come out also, that can clear. So Hamilton maneuver for an unconscious adult. If the person is unconscious, you can give the Hamilton maneuver in this way. So each abdominal thrust attempts to clear the victim's airway of the foreign object by forcing air out through the windpipe. So how you have to do? You have to give air breath. You have to give breath. First, you will check the object. Then you have to give breath. If there is no breath, then obstructed airway. Then air pass through. You have to check ABC. Airway, breathing, and compression. So summary, first aid includes any one-time treatment and follow-up for observation of minor injuries, includes cuts, abrasions, bruises, first-degree burns, sprains, and splinters. So these things we have learned so far, and we know that how to deal with these things. Injuries or illness requiring only first aid are commonplace. One or more workers should be properly trained to administer basic first aid. Sorry. So as per your employees, number of employees, as per them, you have to train the first aider. If the number of employees are too much, you just not have to train only one first aider. So as per the shift, as per the number of employees, and when that employee, that first aider will be on leave, who will replace that person. So as per these requirements, you have to train first aider. Number of first aider you need to provide. And your first aider should be trained on CPR also. Workplace should have a well-stocked first aid kit and at least one or more employee assigned the responsibility for administrating or coordinating first aid treatments. So when an injury does take place, whether it is to ourselves or fellow employees, knowing what to do and being able to react quickly can limit the severity of the injury or even prevent a death also. So the first aid is best tool to help your co-workers, your family, or maybe you know. So thank you so much. That's all from my side for the first aid training. We have completed the first aid training. And I hope you like this video and the information which I have provided to you. And one more thing I would like to request that before you perform any first aid, make sure you are trained properly and you are allowed to do the allowed and you can perform properly first aid. So that is the requirement that you have to follow. And if you don't know anything about the first aid and you are not allowed to do the first aid, please do not attempt. Okay. So thank you so much for your time and patience. See you in the next video.